Great. There's our friend. Always the one to announce it. Okay. Well, welcome everyone. It's great to see you all. I know September is so busy and a lot of schedules, end of the fiscal year. So thank you for making time for this. My name is Steph Fluegeman, and today we're going to go through an introduction to data viz. So what we're going to cover, it's going to be a lot, and it's going to be information overload. So the purpose is really to focus on the who, what, why, and how of data viz, and what data that is available to you. So we'll walk through how to find those data sources that relate to ACEs. We'll cover some tips and tricks for good design. And the goal is really to get you thinking about how to plan ways to use data viz techniques with your own data. So first, I want to introduce my lovely co-hosts for this webinar, or training, I guess. I'll give a little bit more about me later, but first, Michelle, would you like to share what we're all doing here?
Yes, if I can find my unmute button. Good morning, everyone. Thank you so much for being here today. As it says here on the slide, my name is Michelle Walters. I am the ACES project coordinator at MDHHS. I've been here just over a year, and wonderful to work with Stephanie throughout this year, and even Kelsey. She'll introduce herself and her role. My position really is to work within our state systems and look at and assess and work within our state programs and state systems to ensure that what we're doing, the policies, the practices, and the culture in which we create at our state level systems actually works to minimize and mitigate ACEs, trauma, and toxic stress. Because what we would hate to have happen, which we know has happened and does still happen to this day, is the things that we do at the state level can cause trauma to individuals, whether it's a coworker within our state system or within community. And so we want to do what we can to help minimize and mitigate that trauma. So that's my job. Not a big deal, easy peasy, right? We've got all those solutions in our back pocket. But yeah, I've been doing this just a little over a year, and I'm really happy to be here. But like I said, my role really is to serve at the state level function and work collaboratively, obviously, with all of you wonderful people here at the community level. I'm really glad Steph is able to bring this information to you all because she has amazing ideas and an amazing brain, and I'm just glad she can share this with you. So I'm glad you're here, and hopefully we can gain some really great information today.
Thanks, Michelle. And Kelsey, yep, I see you're on.
Hi, everyone. I'm Kelsey Sala-Hamrick. I work at MPHI as a research scientist and clinical psychologist, and I'm also the Michigan ACE Initiative project director. Really happy to be here and see a lot of folks who have been connected to the Michigan ACE Initiative here. As kind of Michelle said, we've been talking a lot about just how we're all doing. We've been talking a lot about how we're all doing very similar work, sometimes in different sectors, and it's just really nice to be able to collaborate and train and learn together. So happy to be here and happy to meet those of you who I haven't met already.
Awesome. Thanks, Michelle. Thanks, Kelsey. So throughout this presentation, if you want to use the chat feature, I will try and monitor it. But Michelle and Kelsey have my back on that. So any questions you have, we'll get into that housekeeping in a little bit. So a little bit more about me. I'm a big data nerd, as you can see. Even when I'm on vacation, I try and find that data viz in the wild. So this is a really cool data viz that we found in Anchorage, Alaska, showing some warming stripes over the years, and visually seeing how global warming is affecting our world. So I love data viz. I am not a graphic designer by trade. My background is in public health. I work at Michigan Public Health Institute in the Center for Healthy Communities. And in that, I have just grown into this role of really loving thinking through how to take data and turn it into actionable pieces, whether that be presentations, infographics, reports, dashboards. So a lot of my information is self-taught. Again, I am not a graphic designer by training. I've just really been into this and tried to learn all I can. So, I know that a lot of people are coming with lots of different backgrounds, and I'm so open to learn and know more about, what you know about data viz and graphic design. But that's just my caveat is that, I love it, I learn about it, and I do it in my job at MPHI. And I also teach trainings like this. So that's my little plug that if you find some topic in this training that you really like, I'm happy to work with other organizations, partner with you all to either train you on these topics or to do the work to make the infographics. So throughout this presentation, again, if you want to use the chat, if you want to raise your hand, if you just want to unmute and share something or ask a question, I'm open to all those options. You can have your cameras on or off. I don't mind, any way that you want to show up to this meeting is all good. So for over the next 2 hours, we'll use these tools. We'll also use those little reactions. And we'll also use the annotate button. So if you look up in your pane, you'll see annotate. It should be available if you have the updates. If you're joining from your phone, this might be a little bit more challenging. So you can always, when I ask for something like this, you can drop it in the chat if you prefer. And then there's a stamp function. So some of the stamps are like hearts and stars and check marks. Not a big deal if this is not your thing and you just want to sit back and enjoy and not have to be clicking on your screen, but these are some of the tools that we'll use. Okay, so first little practice with our annotation. These are some of the goals, the learning objectives of this presentation. So we're going to identify and describe some appropriate ACEs data sources. We're also going to think about how to use data viz techniques with your own data and learn some tools and tips for good design for data visualization and find out about tools and resources to create and share these messages and efforts in your community. So I love using animations in an ironic way. So I had the little stamp come on in. If you want right now to get that annotation tool and go ahead and stamp on the screen or write in the chat, which one of these are you most excited about? Oh yeah, here they come. Yeah, so they show up a lot smaller on the screen than what I thought they would, but yeah, it looks like lots are excited about tips. So we are actively creating visualization, right? Yeah, great. So you found the annotation tool. You have created our first data viz piece. It looks like a good even mix of finding those data sources, those tools and tips, some resources, how to create messages, and those techniques. Awesome. And then someone was like, I just want to scribble on this page. Awesome. So I am going to.
There were some people that indicated in the chat as well for you, Steph, that using data visualization. Yeah.
And then I need to remember how to clear this. I think so. Let me get rid of that. Okay. Cool. So one more piece of participation, if you'd like to go to the chat, and I'd opened it up in the invite and the email before, but if you also want to share in the chat something that you really hope we talk about, you can either unmute and let me know, or share in the chat, and hopefully we'll be able to weave that in. And if anyone can give me a little tip on how to clear the annotations.
So I think in the menu, all the way to the right, it says clear and there's like a trash can. Did you try that? So in the annotate menu
Yes.
is where I found it anyway, but obviously I can't clear it because it's not my presentation.
There we go. Got it. Thank you.
Yay.
Thank you.
Teamwork.
All right. Oh, and thanks, Al. I appreciate that. Okay, so how to make data clear and interesting for non-data nerds. Okay, yes, we can do that. And hoping to hear about unique ways to share data with the community. Awesome. Techniques. Clear and interesting. And quantify progress, how to figure out what to share with so much data. Yes, Jody, I agree. Yeah, these are all great directions. Feel free to keep dropping them in the chat. We are going to get there. We're going to cover so much of this. And I'm also open to, after this, you have my contact information, and we'll be able to, keep the conversation going if you have more things that we should cover in next presentations in the future. Okay, so the first thing that I wanted to cover is, what is data visualization? I define it as a really simple graphic representation of information and data. That's it. Graphical representation of information and data. I'm going to clear the annotations again. Thank you all for the contributions there. All right. So really simple definition that can get pretty wild all over the place with how we define it and how we chunk it out and learn about each piece. So today we're going to walk through 3 different sections. It's going to be the basics. So we're going to talk about what data visualization is and why it's important. We're going to talk about some principles of good data design. And then we're going to end it with a practice session. So you all should have received handouts. I will send some handouts at the break in the chat, just so you have those if they didn't come through in an email. But these 3 pieces are going to make up today's session. It's going to be a lot, and it's going to be a little bit about a lot of things. And I designed it this way so that you can just get an interest in certain areas and maybe come back to it, find them on your handouts, dig a little deeper. But I wanted to give an overview. So if you know a lot about one topic, maybe there's something else you pull out of it. I always like to think about going into trainings that as long as I get 2 pieces of helpful information, that's all I need. that is time well spent. So I'm hoping you get a little bit more than that. But just know that if I move fast, if I only mention something for a little while, it's intentional so that I can give you a little bit of pieces about everything. Not everything, but a lot of things. And then you can do some more exploration. So truly a 101. So let's start with the basics. We can use the chat here if you want to introduce yourself in a visual way, maybe pick out an emoji of how you're feeling right now. Yeah, let's do that. Let's pick out what emoji describes how you're feeling about data viz. Go ahead and add that to the chat. I'll do mine too. Michelle, yeah, I love the little glasses emojis. That's great. I'm gonna put a little, that one's mine. Awesome. I love seeing that roll in. A lot of people have their little like nerdy glasses on, so loving that vibe. Great. Keep on adding those. I'm gonna roll on through and let you know a little bit more about the why, the purpose of data viz. So why do we need to be doing this? One thing to think about is communicating information quickly and easily. I know that that was said in the chat, trying to make things clear, make it easy for understanding. So good data visualizations show the data, and they present numbers in a condensed format. And we're really trying to make big data sets coherent a lot of times. Maybe it encourages the eye to compare pieces of data. They can also be used to engage audiences. So I use this a lot in my work. I'm handed a 50-page report, and I'm asked to either design all of it and make the information graphically interesting, or the ask is to take all that information and make it into a one-pager. Quick facts, something that we can engage audiences, whether putting it down at a school board meeting or bringing it to funders or sharing it with the community. The purpose is to engage audiences. We want to stand out in the crowd. So if you're writing grants and you want to share something about your program, or something that is going to really stand out on a wall in a clinic, that's a good place where data viz can come in. And what I use a lot in my work as an evaluator for MPHI is identifying areas for need and improvement. So this could be like following, these are our measures for the program. These are our areas that, I'm losing track of the word, but these are our areas, our benchmarks that we're trying to meet, and using data viz to quickly convey that information of how far are we close to those goals and how much room for improvement do we have. I did want to make a note that data viz, one use that I see a lot is to convince people of something, or to visually steer people in one direction. So data viz can be misleading. Here, if we look at this data viz, what do you notice? For me, I noticed that I don't want to buy ice cream anymore because that means it's going to lead to a shark attack. And and I know both that is a jumping to conclusions moment, and that really it's just a correlation that as ice cream sales go up, it's warm in the summer, shark attacks go up, because somebody here that's an animal expert knows that. But so the point is that we want to not jump to conclusions, and we want to be critical when we're looking at data viz, and when we're thinking about data and what it means, especially in this field when we're looking at ACEs, and not wanting to jump to conclusions about just because ACEs are higher here or here, it doesn't mean XYZ. So that's just a little caveat as we're looking at these data sets and sources and data visualization. There's a lot of chance for misinterpreting or misleading. So that's where we're at. So another piece is the who you can share your messages with. So the audiences. So when we talk about data viz audiences, it's thinking about who can you bring these messages to. So not everyone needs to know everything. I like to think about the need to know versus nice to know. So you really have to pick the right information for the right audience. And the way you talk about data might be different depending on who is seeing this data visualization. Different languages for different groups. For example, can you use acronyms? Is the data viz that you're creating going to a group of people that are going to understand all these acronyms you're using? Or do they need to be written out because it's going to the general public? Do you need to explain what ACEs are because it's going on a product for the general public versus a presentation to these master trainers and community champions, all of you that know generally what ACEs are, and does it need to be written out that way? Do we use language like statistical significance? I would say for general public, no, not really. That's not something that needs to be shared in that way. So thinking about the audience, thinking about the language you're using, and the type of data that you're sharing. So you may be sharing things with youth participants, if you're running a program, maybe with other staff members. This is CHC from 2016, so please don't pick me out in that crowd. And then you may be sharing it with health departments or school boards, maybe some funders or policymakers or the general public. So all of these audiences, I encourage you to think about how can we shape that message that we're trying to share about ACEs or share about any other data that you're collecting, depending on what audience is going to receive it. Another consideration that comes up at the state level a lot is reading level. That's also a thing to think about when you're picking what audience to share it with. All right, so the what, the data sources. I know a lot of you chose that first objective. You're really excited about to learn what there is out there. After this presentation, we'll share a list, and maybe in the chat at break, we can share a list of all of the data sources that are available that we're sharing in this section. But we wanted to just put a bunch out there. So I think a lot of people feel stuck when they start thinking about what data is available. And it's good to know that there's a lot of potential data sources out there, and that you may already be collecting some of these things or have access to these things. So we're going to use that annotation again on each slide. I'm going to be so much quicker at clearing it now that I remember where it's at. So if you want to use that stamp tool, and as we get to that slide, just let me know if you've question mark, never heard of it, the check mark, I know of it, or the heart, I have used this before and I love it, or maybe I've just used this before, I don't know. So this is our first source. So the Michigan Youth Risk Behavior Survey, YRBS, this has questions about ACEs on it. This is a great tool. You can drop down by school district, by year. Really cool. Yay, a lot of people have used it. Awesome. So next one. Oops. And then what about the BRFS? So this is Michigan BRFS. Really cool thing. I noticed that they've started doing a Power BI dashboard. So this is the same thing on the next page. You can go to the BRFS website, and they have some interactive dashboards that break it down by all of these demographics. BRFS is where we get ACEs data, or at least a very large source of ACEs data. And I'll show some examples of some infographics that I've worked with Jody and Michelle to create, and that uses this data and breaks it down. Cool. Lots of people know of it, have used it. And what about tribe-specific surveillance health surveys? So this one I think was new to some of the presenters that I'm working with. That at MPHI, I work with Sioux Tribe, and we have done a surveillance survey for the past 15 years. We've done every 5 years a collection. There are a few other federally recognized tribes in Michigan that also collect BRFS tribe-specific data. A lot of this is it's permissions based, so contacting the tribe, seeing if they're open to sharing and what the purpose is. But it's really cool work that's being done, and it's giving a tribe-specific level to the BRFS data. Because we know the BRFS isn't always representative of smaller groups. So this is really cool. I know that in the registration, someone had mentioned about wanting to learn about sources, and they're out there. It just is, a little bit more of a level of, asked to get to that data. And then we've got the MiFi, sorry, I thought someone said something. The Michigan Profile for Healthy Youth. This one, I don't know much about it. I'm just sharing what what has been found. I think I may have used this before, but this is, yeah, okay. Looks like a lot of people have used it too. Awesome. And then there's the Kids Count Data Center. Awesome. Looks like a lot of you on this call know a lot more about this data source than I do. That's great. I just wanted to put these out there as ideas for different sources. If you have questions about these data sources, I know that you know, Michelle, Kelsey, they're good resources for this. And I'm excited to share the next one with you because Kelsey can tell you a little bit more about it. It is the My ACE data dashboard. Kelsey, you want to talk a little more about it? Thanks.
Sure. Yeah, so if anyone is interested, if you haven't already seen this dashboard, you can use that web link at the top of the page. It's myacedata.org. And the goal with this dashboard is over time to really have this be a dashboard where we can integrate many different data sources that talk about ACEs, that talk about positive childhood experiences and other kind of both protective and risk factors for children and families in our community. It is youth-based data. So I really appreciate staff talking about a lot of the other surveys are also adult-based data. So you can think about where you want to get data for different populations as well. For now, if you want to jump to the next slide, Steph. For now, we have three main data sources that are in this dashboard. So the Youth Risk Behavior Survey, which Steph talked about a little bit, the Michigan Profile for Healthy Youth, or the MiFi, and Emergency Room Department Syndromic Surveillance data. So that is data from across the state of Michigan, from hospitals and emergency rooms that are reporting different conditions, including child abuse and neglect and other ACEs. And over the next few years, we're going to continue to add data. We're working with Kids Count and many other kind of groups to add more data as well. So if you have more questions, feel free to contact me.
Awesome. Got one more for you, Kelsey.
Oh, I forgot. I was too quick. But yes, and so here's, you know, in the spirit of data visualization, here's some of the things that we've been looking at as you dig into the dashboard, kind of thinking a little bit about the goal of this dashboard, as well as to kind of make sure we have explanations that are really clear about what this data means and help kind of guide community members and different organizations and how to best use this data. So you can look, you can kind of click through at a county level, at a state level, different years to kind of see what's going on, and then kind of go through and investigate what data you want, kind of dependent on where you live and kind of what you're looking for.
Awesome. Thanks, Kelsey. And thank you, Michelle, Kelsey, for kind of collaborating on this presentation and getting us here. I know I've worked with Jody to kind of envision what this would look like many years ago. And so it's really cool to see us all come together and provide this training for, you know, our group of friends here today.
Stephanie, I don't know if you saw that Cheryl had put a question in the comments. It says, I noticed that the middle info was not included in MiFi. I'm not quite sure, Cheryl, if you want to clarify what that question is, or maybe you know what that means, Steph. Middle school.
I think just in the screenshot, maybe I didn't have it there. So it's yeah, it's good to know that that's there and that's available in the MiFi.
But it is included in the full data set. It's not, yeah.
And I'll also just mention that, so the MiFi is voluntary based on school district, and I don't know all the details of that, but I know that high schools and middle schools can kind of decide whether or not they're going to use this survey. So if you have more questions around that, I would reach out to folks in your community or your region about whether or not they're using it. Any school or school district that completes this also has access to their own data. So if there's something we don't have or it's not on these things, it might be because you need to reach out to kind of more individual school districts or regions.
Yeah. Thank you. Yeah, so on the screen I have one of the products that we've worked on, Jody and I worked on a few years ago, and this is first use of the BRFS adult data. So zooming in a bit, I just wanted to give you an overview. These are available to you online, and this is using the BRFS data and presenting information about why it matters and how common it is. We're also looking at the frequency of all these different types of ACEs, and then ooh, don't get nauseous. There we go. Then we're looking at the relationship between health risks and ACE score. And then a call to action of what you can do to address these in Michigan. There's also the youth version of this. Youth infographic is kind of the companion piece to it using the YRBS data. Again, looking at that same layout. And then we've got a couple other resources that use this BRFS data. And these are the county profiles. So this is Wayne County, for example. And these are also published online. We can get you links after, but just so you are aware of how Michigan ACEs data is being used in these data visual pieces and products, this is another example. So looking at the prevalence of each type of ACEs in Wayne County, comparing it to the rates in Michigan. And this is the entire list of the 10 counties that have this available. This has to do with sample size and what is appropriate to analyze. That's done. The state FE folks are the ones that let us know what is and isn't possible. And these are the 10 counties that have ACE specific data available in infographic format. There's also another series of county profiles that are available. And so I created most of these. We've worked with another designer at MPHI, but this one is abuse specific. So, and this is available for 20 counties. So we had a bigger data set. We were able to combine 2019, 2021, create a bigger sample size, and talk about ACEs as it relates to the abuse specific ACEs. So this is the long list. If you recognize your county in it, that is good news because you'll have one available and something that you can bring along to meetings and talk specifically about ACEs at your county level or abuse specific ACEs. I'll pause on the annotations just so I can get through these next few things. So thank you all for stamping and participating. It'll be sealed forever in the recording of this presentation, and we'll get to go back and see kind of how common all those sources are. So the last few, the community health needs assessment, each county has one. There's some specific examples online, but just so you are aware that it seems that there's a lot of counties that are collecting data, all sorts of data, just not ACEs specific. So that's another interesting data source. And if there's anything I missed, now would be the time if you want to share in the chat. If you have any other data sources that you're thinking about, maybe specific to your city, what did I miss? Oh, the county rankings. Yeah, I love that, Sue. Thank you. Oh, and thank you, Michelle, for letting us know that The 20 county profiles are waiting for approval, but they are so close. Love that state government. And then, so there's a question about if the information will be shared at the next My ACES Summit. Do you want me to present? I will, I'll do it. Yeah, that's a good question. I'm sure that there's some way we can get, either pieces of this or even talking about the data sources. I think the really cool thing that I think Kelsey mentioned, but I'll just reiterate, is that the My ACES dashboard combines a lot of those data sources. So or not like combines data sets, but it kind of it keeps it all in one place together. So that's a huge benefit of using the My ACES dashboard, is that instead of having to search all these individual places, there's kind of a repository. There's a question about if the visualizations, let's see, if the visualizations for the counties that had state level data correct. If so, if we do our own, it's not included.
So I think Steph, and because I know Lee in Ottawa County, I think Ottawa does their own. They have the ability to do their own. They have an EPI within their Ottawa, I think either health department or DHS. And so I think, Lee, what you're asking is that included in the dashboard, or is that included? And I think the answer is no, but I don't know that for sure.
Yeah, it wasn't listed we weren't listed in the counties. And so I just was wondering if that's why we weren't listed, why there wasn't a visualization for Ottawa.
So yeah, it was pulled. So obviously you can respond, Steph, but it was pulled from the BRFS data. And so you do have county level data, I know that, but this was pulled from the BRFS database, which is a different set of data.
Okay, that makes sense. It also makes sense why we wouldn't have youth survey or youth data in there, is because most of our schools, instead of doing the MyFi, do the YAS. So and it looks like the MyFi did not ask the questions about the ACEs in the most recent administration. Those were asked in 2019.
Hey, Lee, if you want to drop your link to your data, that would be cool for people to see.
Yeah, I'll do that.
Does that help, Steph? So they have their own data. And so these data sources were from the BRFS, I think is what Lee's wanting to clarify.
Okay. Yeah, yep. And then we are all done with the annotations. Thank you all for that. Yeah, so some good things in the chat. And then Kelsey did mention that she'll be sharing and connecting the training to the rest of my ACE website dashboard too. Okay, so then I wanted to talk about data viz containers, like the how. So how are we actually going to contain your data viz message and get it into a product? And we will take a break soon. So if you're feeling a little antsy, a break is coming. So I'm using the word containers to talk about like any sort of media, whether it be physical or virtual. And if you hear a dog barking, my mail lady just got here, and it's a very exciting time for my dog. So it'll be over soon. So here's some examples of I should make it a little better. Some examples of containers that you can use in your work. So something like an infographic, or something like a square size that can be online. These are all traditional ways we think about data viz. Also a website, back to our definition, any graphical display of information is data visualization. You can also think about using like a slideshow deck. Breaking up information into graphics, or something that's like a a size for Instagram. So a square shaped container for data. So when I ask you about data visualization containers, this is what I'm talking about. The size, the place that it's being put, if it's virtual, if it's physical. Those are the examples. And then we're to the how. So how are we actually going to do this? We thought about our audience, we thought about our data source, maybe you've thought about the container of how it's going to look. And you thought about the message. So bringing it all together to the crafting your message. I want you to remember that this is an art, not a science, and that there's a lot of ways to do things. I mean, I look at those BRFS infographics and I think, wow, I could have done that totally different. So there's always ways to change, how you are getting the message out and putting it into a data viz piece. So these are the questions I always start with when I'm working with anyone within my team or externally. These are the questions. So what data are you already collecting? What stories can you tell from these data? Who needs to hear that story? And what type of presentation would be best given your audience and purpose? So that's where we're finding data source, and then we pick the audience, we pick the purpose, we pick the container. Clear those annotations. Okay. So walking through a quick example of what this actually looks like, working with a client on this, Jody, I'm calling you out. This is a real way that we went through this. So we talked about what we had. We had BRFS data. That's the data that we're already collecting. When I say we or you or that is already being collected, BRFS data. And we were looking at the ACEs data specifically on the BRFS. So what stories did we want to tell? So we worked together and figured out we wanted to talk about ACEs are common and that they're linked to these chronic health problems. So that was the story, and how are we going to take that story and use what we have to get to that final product. We picked the audience. We said we want to make sure community members, those that work with children and youth and clinicians, that's who needs to hear this story about ACEs data, and that it's important that they're common and that they're linked to these things. And then we wanted to pick the purpose of why are we telling this specific audience this story. And we found that we wanted to really explain that ACEs can be prevented, and we wanted to share resources. That was the call to action that we ended those briefs with. So those 4 questions, the way that we answered them, led us to say, okay, I think that knowing that we wanted to reach community members, we want to share this information, all of these steps, we decided let's make an infographic, and that's how we came up with this adult ACEs, Adults in Michigan ACEs infographic. So those were the steps that we got to, and it all started with looking at raw data, organizing it in a way, coming up with that story that we wanted to tell, and ending it with some data viz tools. So I hope that was a good first chunk of training overview of that is the who, what, why, and how of data viz. When you come back from break, let's take 10 minutes and come back at 10:57. We'll come back and we will talk about some principles of good design. So feel free to take a little break, and I will see you back at 10:57. I'll stick around if you have questions, if you want to chat in the meantime, but I'll see you then.
I saw that Laura even put another resource out there for you, an outcomes resource that addresses social determinants of health. So if anyone wants to take a look at that, that's in the chat too.
Oh, awesome.
Do you want to pause the recording?
Sure. There we go. So back from break. Hope you all got to grab a little snack and feel a little refreshed with a little stretch. So we've got just over an hour left of this training. We will have some time at the end for brainstorming and sharing out. So I'll talk at you for another about 40 minutes with some time at the end for practice. So like I said, a little bit about a lot of different topics. This section is all about the design. So, you know, we've covered the who, what, why, and how of data viz. I'm sure you're wondering, well, you know, I came to this for some hands-on lessons or some tips about design. This next section will talk through those good design principles. So based in the research, based in the handout that I sent you, there's an article that does a meta-analysis of some data viz studies. And these are some of the key words that they find that makes good data viz good instead of garbage. These 6 words are good guide descriptors. We want to make sure data viz is purposeful, that it is clear and easy to interpret. We want to make sure it's strategic in design, that it flows on the page, that it's absent of clutter, and that it tells a story. So those are the big key takeaways of some meta-analysis of what makes good data viz good. And in your resource sheet that I dropped in the chat, I also sent it out in this meeting request. I've got a collection of a ton of resources, recommendations that come from me personally. It also comes from some data viz experts in the field. And my hope is that you can use this resource sheet in further work and share it with colleagues. And if you have any resources that are missing, that are life-changing and I need to know about, please email me. I'd love to add to the sheet and kind of crowdsource all the different ways that we can make data viz you know, easy to figure out. So I'm going to start with what you know, some rules, or what I like to call guidelines. So there's a lot of like rules out there for graphic design, for visualization. I think that there's a huge difference between rules and guidelines, and everything I'm going to tell you are about the guidelines. So things that I think are good for design, but know that you can break them. There's nothing stopping you. There's no police when it comes to data viz. And you know, throughout this presentation, I'm trying to show you some good principles of good design, but know that I'm not perfect and some things may fall short, and don't pick on me if you find things in my presentation that aren't quite in alignment with what I'm showing. So I'm trying to practice what I preach. So the first thing, fonts. A lot of people are familiar with fonts, and knowing that you need to use easy to read fonts. Biggest thing is readability. We'll get into and talk about accessibility and how that relates to fonts. But a lot of people are going to gravitate to this more cutesy font. It is fun and interesting. But when we're designing things for, you know, mass audience, we need to pick something that's more easy to read. And we want to, the added layer of technique is to use a font that reflects your purpose. So what are some purposes that fonts can have? It may be that you want a specific kind of vibe to your product. Maybe that you have some guidelines for branding. Maybe you're stuck within a certain brand look and feel, or maybe you want to pick something that fits a purpose, like kind of more business, more creative, more personal, more minimalist. A good way to do this is just open up a Word doc, start you know, copying the same chunk of text, and then change it to different fonts and see what really sticks with the words that you're using. So if you're writing about ACEs and you're writing like a brief and infographic, maybe not having something like lobster or these creative sketches, but something that's like personal or minimalist or business. Any of those would fit pretty well. And in this presentation, I am using 2 different fonts and I'm using 4 variations within that. So again, not a rule, just a guideline. If you need a guideline, if you need a rule, here it is. Trying to stick to those 2 fonts, 4 variations, keeps it cohesive, professional looking. In this presentation, I'm using Oswald and I'm using Source Sans Pro. And these are also referred to typographies, typefaces. That's some language that you can take from this presentation and use when you're working with a graphic designer, or if you are trying to give feedback to somebody on your team that's doing a visual, or if you're taking this on your own, if this is going to be something you are taking on your team. Another side of this presentation that I'm hoping you're getting out of this is that a lot of the language we use around data viz, that's things that can be used with your in your work, communicating with those people. And when talking about fonts, you can call them typographies. And some of the tools that I have on the resource guide are all about how to pick these fonts. So it may be that you want to do something special and like a custom font. There's a lot of sources for downloading. One of my favorite sources is Identifont. It helps find those fonts that are really interesting to you. Maybe you want to search by something that's similar. You're like, I really like Arial font, but I want to use something different. So you can search something that's kind of like that, but a little different twist. My only warning though, is that custom fonts are downloaded to your computer. And more often than not, what I found is if I do something in a custom font, send it to a client or a coworker in an editable file, sometimes those fonts don't show up the same if they don't have it installed or if they're not embedded. So just be careful with choosing custom fonts. The safer bet is if everyone's on Microsoft products, choose something that's already in Word. Lots of choices, lots of chances to be creative with that. So lots of Word available fonts. Another piece of design is about color. So choosing a color that either follows your organization's brand or is an appropriate color choice for the audience or the content. So those color palettes that we used for the BRFS briefs, those are some color palettes that were part of MDHHS's color scheme. And we want to use color in ways that makes data viz pop and that matches the purpose. So here I've got the MDHHS colors. Again, not a rule, just a guideline. Picking 2 main colors and then having 2 complementary colors is a good rule to follow. If you want to use some shades and transparencies instead of more colors, that's a good way to kind of work in, differences, different shades. So here in this presentation, I used these colors, the sky blue, the bright green, the blue, and the dark blue. And what you'll see is the pound sign, or hashtag, whatever you want to call it. I feel like there's generational differences in how we refer to that little hash mark now. But that is the hex code. So that is a color code used to get that exact color match. And then also the RGB code. And the cool thing, little hot tip here, in PowerPoint, in Word, they've now started in the new versions of these products. I think it's Microsoft 365 or something. You can actually take like a screenshot and you can use that dropper and you can find the exact color so that you never have to like mess with the color wheel. I don't know if this is like bringing back flashbacks for anyone, or maybe still do it, but trying to find that exact match using, you know, the sliding the color up and down. You don't have to do that anymore. You can find those colors, you can pull them off, and you can find that color code and then use that in other products. And I can demo that too if anybody wants to see that at the end. And then I've got a couple other tools on the handout sheet. Jody, I'm gonna add that one to the handout sheet. Thank you. I most often use for color palettes. I most often use coolers or coolors or something like that. So what it is, I've got a little clip I'll play. Is you go to this website and you decide I want 5 colors in my color palette. You select the colors, you can lock them down and say this is the blue and this is the pink that I want. Find colors that are going to go with these 3 colors. So you can lock that color in, and then using the space bar, it'll flip through these other colors that may look well or may look nice with the ones you've already picked. So if you're kind of at a loss for, you know, how to come up with a good color palette, this site is so fun. You can flip through so many and figure out what works best for your product. Even a starting point of, I know I have to use that dark blue MDHHS color. What else can I do that's going to be complementary? Yeah, so that's my favorite. Yeah, so Laura mentioned appropriate contrasting colors, especially against colored or shaded backgrounds for accessibility. Look at the next screen we're on. That was perfect timing, Laura. Thank you. So accessibility, again, a little bit of information about a lot of topics. This one, I want to spend more time on it. I teach trainings on this. I've learned so much from Alice Frame at the state. They do a ton of work around accessibility. And I just wanted to mention a few things. So accessibility is a word you hear a lot. You know, is this product accessible? Did you run an accessibility check? What we're talking about more often than not is, are the colors contrasting appropriately? So is there enough darkness on a light background or lightness on a dark background? Are the fonts appropriate? So are we using things that are easy to read by a screen reader? Is it screen reader compatible? And is, if it's in PDF, has it been remediated, and is the accessibility report coming back clean? So a lot of time accessibility is talking about those that do have vision and need to see things appropriately contrasted, both fonts and colors. And then it's also talking about those with no vision or low vision that are using screen readers to move through the page. So literally hearing out loud things that are read and deciding what order it moves through. So data viz it's so important that we incorporate accessibility, and especially in things like adding alt text. So you see a chart, you understand the visual shortcut of what the chart is telling you, but what does that look like on the back end when someone is you know, has no vision or low vision and needs that read out loud? So these 2 pieces, the colors and fonts, is really a during the design process piece. So during the data viz process, and then the screen reader compatible and PDF remediation happens after the design is final. At MPHI, one of our core values is health equity, making sure that we remove barriers for, you know, giving access to things. And when we're talking about products that are going online, that's a huge thing that we focus on at MPHI, is making sure all of our products that are being accessed by the public are accessible, screen reader compatible, and that we've thought about these things in the process. Ooh, lots to get through with that. So there's so much more about accessibility, Word, PDF, PowerPoint. I just wanted to give you a highlight to know what's out there. And I have some handout or some resources on the handout that talk about the W3C, the standards that are out there, 508 compliance, as it relates to things going online. Also steps on how to do the PDF, tagging, alt text, all that stuff, and a checker for color contrast. So you enter in what we just talked about, those hex codes, those RGB codes, and it lets you know if that contrast is there or if you need to bump it up or change the colors. Now, I do want to say I have not run it on this green color. So if you're looking at this presentation and thinking all the text that's in green, I try and avoid that because I don't think the contrast is there to make that color accessible to be seen. So don't pick on me for that. Then the section about layout. If at any time you want me to pause and talk about something else, I can pivot. But I do want to get through all this information for you, so you have it there. So with layout, we're just referring to the arrangement of the words, the shapes, the data viz pieces, the graphs, all that arrangement on a page. So there's a lot of different options for layout. It's so hard to think about, like, a question I get a lot is, well, do you just have a template? Can I just use a template and like plug in my stuff? Sort of, kind of, not really. A lot of things are customized based on what your purpose is. And if you've gone through those steps and decided this is my audience, this is my purpose, that's going to lead into this design piece and the layout. So what layout is going to best tell your story? These different examples are going to walk through. I'll show you some examples from my work, and I'll let you know which ones are my pieces. So I did not do the one on the right, but this is an example of quick data. It works well for a lot of different types of data. It's easy to read. It's practical. You can get quick messages across. There's distinct topic areas. You're chunking it, data chunking. And it's good for a lot of different audiences because it is just kind of a simple fact sheet. And then there's this versus comparison type look and feel. So it's typically split vertically, side by side. If you're trying to quickly tell readers the differences and similarities between two things. For example, this one, for those that work with home visiting, this is a look at two different types of home visiting programs coming to you soon in a report in the future. But this is kind of just that side by side from my own work. There's also road maps or process maps. Doesn't have to look like squiggly lines on the page, just to visualize a process from start to finish. And this is an example from work I've done with another home visiting program, a learning collaborative. So it's talking through the different steps of transitions, and then some other information in quotes. So it doesn't have to be a roadmap process map, doesn't have to be that really, start to finish. It can be organized in a different way. Or a timeline. So if you have like historical information, if you want to use this in your annual report, talk about accomplishments. I know there was a question about like quantifying accomplishments. I'm thinking also about maybe that question was more like if we can visualize that in some way, and even having something over time like this, number of people served or grants you've received, and kind of telling the story of your project. Doesn't have to be fancy. This is something created in PowerPoint that's just, here's the timeline of the project, here's all of the the pieces from this project, and it shows difference between activities and data sources and the timing of that. So really simple, doesn't have to be super fancy. And then this is an example of heavy data. So it's a lot of data sets come together, lots of stats and charts. It's still chunked out, but there's a lot to process and figure out, what is this story on this page? I worked with the Southeast Michigan Perinatal Quality Improvement Collaborative, and this was something that was highlighting different different things about Detroit. So we looked at community and neighborhood conditions, maternal health. This is available online if you have kind of an intersection in your work around that. So an example of heavy data and a layout to use for that. But no matter what you choose, it's always good to follow how the human brain processes things. So we're used to seeing kind of that introduction, that main body or content, and then that conclusion asked. So it's a logical, clear order. It's following that checklist of things that make a good data visualization. And no matter what you do, this is a really good template to follow. So introduction, main body, conclusion, data scrambled all over. Good. And then we'll run through some other good tips about alignment and organization on the page. Again, this may be, good and or this may be news to you, or it may be something you're already practicing. But just even hearing it out loud sometimes is helpful to know, okay, these are the guidelines, these are the rules of data viz, these are the guidelines. I like guidelines versus rules. So one thing is to think about aligning lining things up on the page. So on the left, you see it's kind of all over the place. We really want to think about aligning things, making it look organized and attractive. Another example of this is finding something to align to on the page. So edge alignment would be like that top photo where the suitcase and the flowers and the typewriter are all sitting on that imaginary line. Or center alignment if things are going to be, different shaped objects. Sorry, that got cut a little bit off in my slide, but so the goal is to make it look intentional. You're placing things on the page and it looks intentional. And then let's see where we're at. Another tip around layout is being conscious where you place elements on the page and finding something to align with. So the difference between the one on the left and the right, we're seeing that all the text is kind of aligned together. We're using the same text alignment. So there's left, right, center, justified. We're picking one option for that so that it's looking clear and intentional. So again, we're being conscious of where we're placing things on the page, finding something to align to, and then using one alignment type. Again, guidelines, not rules. You can break them however you want, but these are the things I tend to follow. And then the big question on a lot of people's minds is, okay, well, where do I find these templates? I just want to drop my data in and I want to drag some stuff around and boom, it's done. It's perfect. It's beautiful. The long answer to it is that there's not a one size fits all approach. I have a lot of layout tools that I shared. Canva is like the hot one that everybody has seemed to heard about. There's a ton out there. My caveat to that is that you have to be careful about how those formats come out, how they are exported. If they're coming out as images or non-editable pieces, then it's a big issue if you're trying to make edits, getting back into the software. Also thinking about data sharing concerns. If you are creating infographics on a cloud-based system that's a free subscription, you have to make sure that you are truly the owner of it and it's not Canva's property once you're done with it. So what I always suggest is PowerPoint. So I find it's easiest to design, it's easiest to pass off raw files. There's InDesign, there's Adobe Illustrator. There's a lot of softwares that cost a lot more than just the Microsoft products. So I am a little bit above the times in that I don't use Word for infographic design. Totally fine if you do. But I find PowerPoint, you can change the dimensions of the slide. You can move things around. All of my examples that I'll show you are done in PowerPoint. Oh yeah, is that Jody? Did you about the PowerPoint?
Yes, I said that was the biggest tip you gave me, and it changed everything. It was,
Yeah.
and it feels so logical, or like, I don't know, it feels like a hack, and
Yeah, and we're
I
so
love it.
used to using it. I mean, like we're a lot of us are used to moving things around on like the slide, the slide template and all of that. And if you change the size of it, you can use all of those same strategies for creating that. And yeah, Michelle mentioned about Canva and accessibility. A lot of the issues with Canva that I find is that when you convert to a PDF and then try and do accessibility work, it just doesn't work. It's the fonts that are used aren't compatible, so they're detected as images versus text on the screen. Yeah, I found a lot of issues with Canva. That being a huge one is that the conversion isn't great for accessibility. If you want to know more about that, happy to touch on that at the end too. And then for images, oh, and then so in the handouts, I did want to mention there's if you are curious about, okay, how can I use PowerPoint to make infographics? There's a really cool resource that if you click on it's like the PowerPoint templates through HubSpot. That'll kind of get you playing around with what it's like to use PowerPoint. There's, I think, 10 free templates that you can download and open up and move things around. Really cool if you want to feel like a graphic designer. That is like the quickest step to it. That isn't Canva. And then for layout or for images, very critical piece of the data viz world. It's always a good idea to use matching icons. So you can find these online, lots of resources around where to find icons, but make sure they're consistent. It tends to be the things I find distracting about data viz or infographics is this, when you start seeing icons that don't match, something just feels a little bit off, and it tends to be the images. Also using high quality graphics. So something like this, when it's blown up, it looks kind of blurry, versus getting a really high quality image. So that can really change the difference in what your data viz piece is looking like, if it's looking low quality or professional.
Can I
My
ask
resources.
a question about that, about the
Yeah.
clarity of the image? How do you know like what setting to choose or to save it as, or like how do you determine that?
Yeah, that's a good question. So for example, if you're searching online, and I usually search for like PNG files. If you are converting, like say you have a graph or something and you right click save picture, I save it as PNG. PNG files tend to have like that transparency to it. JPEGs won't. JPEGs are flat. And so yeah, that's as far as searching for images, I know Google has a lot of like features with that. One cool tip though, with icons that won't make you worry about size or anything like that. One of my recommendations is using the Noun project. So it works right in PowerPoint and in Word. It's in the My add-ins. If you have some sort of like tech IT blockage, sometimes it's challenging to get this on your computer, but this is what I found. So Noun Project has all of these icons. You can search for anything. It's a very reasonable, I think it's like $40 a year for the subscription. You can share it, log in among other people. And I don't know if you're supposed to, but we share one for CHC. And you can search for all these icons. Then it gives you the prompt where you can download it. You can change the colors. You can change the outline of it. You can change the shape of it. It's an SVG file, so it's totally editable once you download it. Very, very cool. It has given me all the icons you see in this presentation, and it's my top choice for those icons and using that. For stock images, I have some recommendations on the resource guide. The one that I find the most helpful, actually, and very weirdly, because it used to not be so helpful, is Microsoft. They're in their 365, they've released a whole series of stock photos that are available. And there's quite a few. It used to be, you know, you'd search for like mom with baby and there'd be one photo. And now there's like 15 photos. So these Noun Project and that Microsoft stock images, those are free to use with a license, and you do not have to credit the artist in it because of the purchase. So I like those. So we've covered a lot of design stuff. What thing is obviously missing? Charts, right? Charts, tables, diagrams, all of that. So this part is very heavy with examples, and again, meant to give you lots of information, or a little bit of information about a lot of things. So when we're picking that chart that is going to contain our data the best and follow all these things about design, we have these 3 principles that I like to follow. And it includes reducing clutter, being intentional with color, and adding interpretation. So those are my chart rules. Not even getting into all the different charts out there yet. I just want you to think about these 3 things. When you're looking at charts, when you're deciding what works best for your data, these 3 items are going to guide this next example. So the data story, back to our first section, talking about the story we're trying to tell. When I look at this boring table, I don't know yet. I think that the story I want to tell is from program A, B, C, and D, who ranks as mostly very satisfied. Maybe I want to see those that aren't satisfied. I don't know yet. I think that my goal is to look at those that are now scoring 75% or greater on very or mostly satisfied. I know that's the story I want to tell because I've been told that that's our benchmark that we have to hit for these program areas. So what we're going to do is we're going to plug it into Excel, and we're going to roll our eyes at how terrible this pre-programmed Excel chart comes out. So although we may be used to looking at this, this is not the answer for the most correct way to, I don't even want to say correct, but the most exciting way to look at this data. So this takes a lot of mental energy. We're having to draw our eyes between the labels at the bottom, the bars on the chart, figuring out, okay, can I look at the blue and the orange and add that up? It's a lot. It takes a lot of mental energy. Data viz, we're trying to cut through that and make it really easily digestible. Using those 3 principles, this is what we're going to do. Boom. So in here, we are reducing the clutter. We're taking off everything that's not needed on the page. We have direct labels. We have a story at the top. We are guiding the reader to understand who met the goals for satisfaction and who didn't. We are using color to be intentional and guide the eye towards that. And then we're also adding that interpretation. So we're adding that 75% benchmark. Way easier, right? Here's our before. There's our after. Really, really easy to see what we're trying to do here. Here's another example for those that are like, I love pie. Let's talk about pie charts. Great, let's do it. We are talking about pie charts, thinking about those 3 things: reducing clutter, being intentional with color, and adding interpretation. This one, it's okay. It's you know, it's taking that mental energy. We don't know exactly how much is in each category, but we see it. We see that there's a lot of people very satisfied, but it just is the plain boring output from Excel, from PowerPoint level of satisfaction, very, mostly, somewhat, not at all. Okay, what if do a little upgrade? So we are reducing the clutter, we're being intentional with color, and we are adding interpretation. We are letting somebody who looks at this in a report say 85% were satisfied. Great, I got it, moving on. Takes no more than 10 seconds to read that versus on the left, that pie chart, a lot more mental energy. So back to it, we've got those rules that are really just guidelines. With charts, I'm going to let you know a few quick chart guidelines that do feel like rules. There are some non-negotiable rules to charts. The first one is that bar chart baseline must start at 0. Non-negotiable needs to happen. This is how we show proportional differences in a correct way. 0 to 100 versus starting at something on a baseline. Great. The other piece that I would say is a non-negotiable rule is that we want to keep the pie chart slices to 2 or 3 portions. So not great. You've probably all seen those giant, multi slices to a pie chart. Really hard for our brain to process the difference in proportion when it comes to circular objects. On your resource handout, that research link that I sent or have at the bottom, that details all of these studies that show proportion is easy for the brain to understand if it's in bar charts versus pie charts. So keep the pie slices 2 to 3 portions. And pie charts have to add up to 100%, guys. It just has to happen. We can't have any of those, check all that apply questions. Nope, that is not for a pie chart. So many other options. Pie charts have to be 100%. Okay, well, I feel like now's the time to pause and say, I'm running out of time. I have a lot more information I want to share, but I don't think that I have time to share it all. And I want to make sure we have time for questions and we have time for discussion. So I am going to give you an overview of what could possibly be the next presentation, or if you want to dig deeper with me in your organization. I have a lot to share about choosing charts and what is going to be the best, depending on what data you have. At this point, you might be like, I'm already overloaded. I'm good. I've got design stuff. I've got layout. That's all I want to think about. And I do see, thank you for sending questions because that helps me kind of focus. How to convert the typical Excel chart into something more visually accessible. So I would go back to looking at these examples, Teresa, is I think that these types of conversions, something that's a typical versus converting it to that, these hands-on skills are like not a 15-minute show. It's a lot of things that take practice and figuring out how do I actually manually manipulate this chart to make it look like, something like this. And once you get into the practice and have a template, it's really easy to use it across projects. So I would say that there's some examples in the handout of how to make charts in Excel, doing things like this, these upgrades to charts. That's a lot of like hands-on practice. And if you can see this and think about, okay, what do I need to do in Excel to actually replicate this? It's all about the trial and error, playing around and figuring out, okay, I want to add in this, I want to add in this bench, or Sharon, did you need to unmute? Okay, sorry. So, I want to add in this benchmark line. How do I do that? So it's a lot of just figuring out what you want to create, and then looking up how to do that, teaching yourself that, or finding the Excel resources, or if you want a more in-depth hands-on training on that, that's also something I offer. And then Cheryl asked about survey questions with equal responses for very satisfied to very dissatisfied, on a 5-point scale, how you would do that. It depends. If you wanted to show only the very satisfied, it would depend how you quantified that, if it was truly like a benchmark that you're trying to hit. So that would be something you would do beforehand, decide on, okay, this is how we're going to analyze the data. We're going to look at only those that said they're, very or mostly satisfied, and then those that are, somewhat, not or not at all are grouped together. So that's more of a data analysis question.
Thank you.
Yeah. Skipping back through. So just a little quick look at all the different ways to think about choosing a chart. I have a lot of examples on questions to ask and how to get to that chart, but I did want to show you just all of the options available. Ooh, speeding on through, and I want to show you where you all land in terms of data viz that I picked to represent the registration here. So this is just a standard bar chart. As it relates to the Michigan ACE initiative, I am ... And we have about 36% of people that registered said they're a master trainer. 31% said they're knowledgeable or previously attended an ACEs training. 28% community champion, and 5% something else. So this is great. This is a good way to show that spread of comparing different values, how people answered this question. Another way that I like to look at comparing different values is looking at, a grid or an isotype, it's called. It's just a table that I fill in with a bunch of colors. Really easy to create, really easy hands-on thing to start using in your work. And this is who registered of the list of, it was nearly 100. These are the counties represented. And I love this type of, I love this type of representation. We get to see those hotspots. Of course, we see that Wayne and Ingham, Oakland, Ottawa, all very high representation. Another section here talking about the relationship, some examples on how to show a relationship to data. There's a lot of different options. I'll give you all of these slides so you can go back through and read each type, see each type. Big exposure. I feel like this is like an exposure therapy moment of like, there's a lot of data viz options out there to represent what you're going for, distribution, or if you're trying to show composition or distribution. These are some other options for you, data changing over time. Want to get to the good stuff too. So qualitative data. That's probably the next big thing that you want to know about and talk about. We're done with all the charts. There's just a lot there to choose from. Qualitative data doesn't have to be limited to word clouds. I know that that is the typical thing that we see, but there's a lot of other options. Qualitative data can even look like just bolding words. If you have a quote and you go through and say you really want to learn about, how often people say the word data or something. You can also use like a call out box to represent like a quote. That's another cool way to use qualitative data and make it visual. So data visualization is just the graphical representation of data. You can use a timeline. Not a lot of numbers on the page here. Or maybe a journey map. So back to those examples of the container, we chose to do like a journey map here. You can also use just icons and color coding. So if you think about in a report, if each icon represents a different section or a different theme that you write about, simple way to use qualitative data. A speedometer. So this is not represented by quantitative numbers. It's just assigning, what participants said with an emotion. So feeling unaware, feeling surprised, feeling supported. This is a speedometer using qualitative data. Another easy one to start incorporating into your work, if you have like a that satisfaction question and then you also have quotes, you can connect those quotes to those different levels. So it flushes out, it gives a little bit more meat to what people are saying when they are really satisfied. So thinking about showing those open-ended qualitative questions next to the closed-ended data, a little bit of way to incorporate qualitative in. I do have to shout out to word clouds. I think they can be cool when they're done right. Like something like this, like people asking their to describe their favorite teacher using only one word. I think word clouds are great for one word answers. They take out all those like in between words. I tried to do a word cloud of everyone's job titles that registered for this. And it didn't look cool. It just did not look cool. This looks cool, and I think word clouds have a time and place, and with qualitative data, having it be intentional word clouds can be cool. I have a couple cool examples in here too, from Dark Horse Analytics, where what someone had asked in the chat about, you know, how do we do that hands-on skill? I think the exposure of how we can start thinking about reducing the clutter, being intentional with color and adding interpretation, the more exposure you have to it, the more likely when you look at something and try and create a data viz from the data you have, it's going to come a little bit more easily. So this is an example of how to use those, the difference, I know, right? Using those strategies to create something much more clear and easy to read. I'll let it play.
I think sometimes we think more is better, and sometimes more is just more.
Yeah. Reducing that clutter is just, and especially when you don't need it. When you add those direct labels, why do we even need that axis? We're already seeing that comparison between those numbers. We're trusting that it starts at 0, and then we're seeing how that compares. Here's one. Actually, let's do the pie chart. No, we don't have time. There's so many examples. I love that they have some really great ideas online. And we have come to section 3 with only 4 minutes behind my self-imposed schedule. So I'm very proud of that. We could have talked about charts a lot more. Like I said, there's just a lot to know once you see it broken down this way, and all the categories to think about. You know, it's gives chance to figure out, okay, well, what is it about data viz that you're most interested? Do you want to jump right in and do hands-on skills? Okay, go right to those layout. Do you want to learn more about color theory? Do you want to learn more about crafting the message and then communicating that to your design person? So any piece in this journey that excites you most, if you're the data person, you're like, I just want to analyze the data and I want to communicate that to the graphic design person, that is so great too. I hope all of this time has exposed you to new ideas and new things to think about. And it is time to brainstorm some ideas and put them to work. So I added in the chat before the section, it was at our break time, I added that handout guide. It is an editable, fillable form. So if you want to pull that up, we're going to start with getting some ideas down and having some sharing time. So the questions on that worksheet, everything we talked about in the first section, what data are you already collecting? What stories can you tell from the data? I'm going to have all these up at the end of this slide. Who needs to hear your story? So pick an audience. And who would you be telling about this story? Or why would you be telling this audience about this story? I can read my own slides. There we go. So pick a purpose. And pick a container. If you know what you want your presentation to go in, pick what is going to be the best for that audience and purpose. So having all these questions up, I'm going to leave them up. And let's take about 4 minutes to think through. If you'd rather drop your ideas in the chat or fill out your handout, if anybody needs that sent in the chat, just let me know.
When I type in the box, Stephanie, how do I get it to go, like, the line just keeps going and going? I can't get it to do a second line so I can see what all I just typed.
Oh, I'm sorry about that. It must be the PDF design. I'm not sure.
Okay.
Michelle had quickly problem solve that. It's like a fillable form edit. So
Yeah, no, that's fine. I'll
apologies, everyone. I tested it out to the first couple makeup types and then didn't realize it wasn't formatted that way.
Is anyone else having that experience, or is it just me? It might just be me.
All right, I'll give another minute. Some just quick ideas, just getting them out there. All right. So who wants to share? I'll give two options. If you would rather share some ideas about what we just worked on in the worksheet, and just let us know what you're thinking about if you're crafting something in your work, or if you want to talk about ideas from today that you're going to try out in your work, anything with design, anything at all. Love to hear from some people, or drop it in the chat if you don't want to share out loud.
Happy to share.
Yeah. What do you got, Teresa?
Okay, let's see if I can share this. And hold on. All right, so we're doing some patient satisfaction surveys. And one of the things that I'm most proud of in that patient satisfaction survey, because this took a while for us to develop the question, is a question on how patients or clients perceive how satisfied are they with how we addressed issues or took into consideration issues of gender, race, ethnicity, religion, etc. And so they give it a score, I think, if I remember correctly. you know, how satisfied, very satisfied, dissatisfied, or whatever. And for us, the prime audience would probably be funders. And how would I be, why would I be telling this audience about this story? Well, attention to health equity has exploded, and it's like, you know, I really want to show that we're doing something around this. What type of presentation would be best given your audience and purpose? Pick a container. I wasn't quite sure what you meant by that, so I put down PowerPoint. Is that kind of what you were thinking of?
Yeah, like presentation slides. Is that what
Okay.
you're thinking? Yep.
Yeah, and then what visual would work best to tell this story? So I was thinking some sort of a graph, and I'd have to play around with that. And I actually have an intern who's going to be working on this. So I thought this would be really cool to have that person and I sit down together and play around with this to look at some of the different ways that you had presented in terms of how to present graphics. I didn't go into any detail because I'd have to play with it to know.
Yeah, and shout out to the intern if they're watching this recording. Hello, Teresa talked about
They're
you.
not, so they're not.
Okay, I meant yeah, later if they get access.
Yeah.
Yeah, thanks, Teresa. That's great. I'm really happy that just based off this information to kind of get a clear, you know, vision of where you're going with it. Does anyone else have did they fill it out? Feel free if you want to screen share or just say it out loud. Love to hear other ideas. Oh, Jody, you've got your hand raised. Yes.
Yeah, so I don't have a screen to share, but I've been chatting with my data person here at Children's Trust Michigan. And I think one of the things, the biggest question for me is question 2, what stories do we want to tell? But then why would we want to tell them? So I think our struggle is that we have a strategy team, we have a board of directors that drives our work, and they have some funding quadrants, and they always want to know how is the work we're doing tied to these funding quadrants. And so, you know, what stories could we tell around that? But then we get to question 4, and why would we tell that to like the public? Like, not that it isn't important to our decision makers and our leadership, but is it really important to the public? And in talking with Atticus, like, obviously it feels like it's important to tell the public that what we're doing reduces child abuse and neglect, because that's our mission. So really thinking through these questions, I think, helps everybody understand, like, yes, we have data, and yes, we can put what we're doing, the work that we're doing and the outcomes that we have around that work against the funding quadrants. But why would we tell that if what we're trying to do is tell the public? Why would we do that? Like, it doesn't mean anything to them. So it was like a big aha for me just now.
Awesome.
Am I making sense?
Yeah, well, and it's like it goes back to, is this even needed? Do we need to, and not specifically.
Right. No, right.
When people talk about, oh, can we put that as an infographic or visualize it? It's like, but why?
Right.
You know, who's the audience? Why are we even trying to get it to them in this format? And can we pick a different format that's not so resource intensive, or, you know,
or internal, or for internal facing instead of outward facing? I guess that's, and then the other thing I struggle with is the what, and you and I did this together, but what story do we want to tell? And I think sometimes I know I skip over that because I get so excited about all of it that it's kind of like white space on a document. Like, I have to stop for a minute and edit myself. Anyway, I could go on and on, as you know.
Yeah, I love this. This is why I'm in this work. I did want to wrap up with a couple of things. Thank you both for sharing. And if you do get to the point in this of sketching it out and wanting to share that with me after, feel free to send that to my email. Love to see some sketches of what you're envisioning. And then if you want to MPHI CHC with me in particular, this is what we do. As Jody said, I've worked with Michelle, all on contracts that are around this purpose of how do we visualize our data. The resource guides are available to you. Again, if you did not receive them in the chat or email, I can send those to you. I'll hang around for a few minutes after, but Kelsey has some information about what's next, unless Kelsey, if you want me just to cover this, or you can feel free to jump in here. Okay, you're still there.
I am. It's great to see so many people who are already affiliated with Michigan ACE Initiative. We're going to be sharing Steph's resources on our data training like resource page as well, and I'll try to see if we can email it out to everyone too. But if you haven't been involved or want to make sure you're on all of those listservs, please check into our Take Action sign up form. You can follow this QR code here. And as you know, we're kind of working, and Steph and I both work at MPHI. We're all Michelle, Jody, everyone on this call, we're all trying to collaborate and think about all different ways we can kind of move this work forward. So please reach out or kind of link or follow these links if you want to learn more.
Yeah, thank you, Kelsey. And thanks, Michelle, for working together to get this going. Thank you for Jody for originally conceptualizing this 2 years ago with the budget. If you have any feedback, I'd love to hear it. You can go over to this link and take the evaluation. It's very short. It gives me things to know to do better next time. And you can also, add comments if you want to see other future trainings, different topics. Yeah, I think Michelle dropped that in the chat. That's all. I'm going to stop screen sharing. If you've got that link, and let me know if you have any other questions. Oh my gosh, 2 minutes left. This is amazing. I really appreciate you all being here. Happy September. I hope you all get all the things done on your list as the year, well, the year is not closing out yet. The fiscal year is closing out, but yeah.
I know there was so much more you wanted to get to today, Steph. So I just appreciate you kind of cramming in as much as possible. And I really do hope that it was helpful for everyone who was able to be on today. If you do have questions, reach out to any one of us. We're happy to get you connected and even provide you with whatever resources we have available to any of us. So just appreciate you being here and being supportive.
Yeah.
Yeah. And please fill out that survey so we can add any other trainings onto your list.
Oh, good. Thank you. That's so nice.
And maybe a 2.0. Did you see that? Someone said, what about DataViz 2.0?
My favorite is I didn't expect to get that much out of it. And that is always the goal. Like I said, I go into training saying, can I get 2 pieces of information I've never learned before? That's always my goal. So if you got more than 2 pieces, that is above average compared to what I get out of training. So I love that. Thanks, Risa.
Thanks, everybody.
I'm also curious if anyone joined and they're like, I've seen her before. Like I've seen her at a conference. I've been around. I've worked with the Kara's program, teen pregnancy prevention.
Yeah, teen pregnancy prevention. Yeah.
Michigan Premier Public Health Conference. Yes, there'll be a recording. I'll stop bragging about myself and I'm going to pause it now. So